I think it's very easy to become instantly overwhelmed when you hear that your child has cancer. Our life is full of doctor's appointments. We are in the hospital almost every other week, inpatient for chemo. On the weeks we aren't, we're outpatient for chemo and we're in the oncology office, and then we're getting counts checked and scans. My biggest job right now is to keep my daughter alive, but also to advocate for her. I'm very hopeful that Haley Holder will beat cancer. I'm hopeful that we'll get to watch her grow, and we will get to send her off to kindergarten. Being parents to her is the greatest joy we've ever had.
Haley was 12 months old when she came first to us. Her cancer, rhabdomyosarcoma, is in itself very rare, and she had stage 4, which means from the primary site it spread elsewhere. So she needs a lot of intense treatment.
Dr. Nair brought us in to tell us the results of the pathology. She had told us she had about a 20% chance to make it to the age of 4. And if she beat it, that she had about 75% chance of it coming back. From there, we had to weigh our options, where to be treated at. And so we stayed home, we stayed at Navicent, and it was hands down the best decision we ever made for our daughter.
She underwent first surgery, started treatment with chemotherapy, and now she's maybe 1/3 done.
There were several nights before we started that we wondered if we were truly doing the best thing. It's fairly easy to respond to treatment, but the problem is when it comes back, there's not a lot of options.
Now to a critical shortage of a life-saving drug for children with cancer. With supplies running short, doctors have warned they may consider rationing it.
The Children's Oncology Group, an organization that makes the pediatric cancer guidelines, released a letter about the shortage late this afternoon, saying they're trying to figure out what's going on.
When the COG came out with their statement regarding the potential rationing of vincristine, that was an eye-opener for not only us, but other Children's Oncology Group hospitals throughout the nation, because it highlighted a potential problem related to the manufacturing and supply of drugs.
Vincristine is one of the most commonly used chemotherapy drugs, and vincristine is a drug where you cannot use anything else to replace it.
COG actually did a great job of sending out suggestions on what to do, what patients should receive drug, what patients should not if it came down to a availability problem. So we just started working really closely to try to stretch the product as much as we could. You think about it, your loved one, you think about it as your child.
Moving into radiation, she had to have vincristine every week in order for it to be as effective as it needed to be.
We were ready to follow the COG plans, but we didn't want it to get that far.
The most difficult thing was to tell the parents there's a chance that we may not be able to give the drug.
Dr. Nair said, let's get you in here a little later this week and then we can split a vial.
Mom asked, you think the one dose will not make a difference? I had no answer for that.
Atrium was really key. When they came through, it was just perfect timing for us.
Navicent came into the picture as part of our normal drug shortage management and action plan. When we first heard about the shortage, we convened a group of physicians, nurses, pharmacists to understand where the drug was used within the system. At the same time, we reached out to the hospitals in and around Charlotte and our regional partners. Their response was that they needed help and they needed 20 vials. Our regional partners know that we're a resource that they could reach out to help solve nationwide drug shortages.
We found out that Atrium provided the first round of 10 vials. It was very exciting for us, and we were very relieved.
There was one mom, I told her that we do have the drug and we will be able to give. She just started crying.
Because of the partnership that Navicent has with Atrium, thankfully our daughter did not miss a dose.
I think she already got the news from somewhere. So she was like, I told you my daughter's gonna get it.
We've fallen back on Atrium a lot of times in the last couple of months for other drugs that were back ordered, and we're always able to call. So when we have a shortage now, we'll call our wholesaler, and the next call is Atrium, and they've got it somewhere.
The care should go on as usual, and so we'll do whatever needed for the patients we care here.
We hit the lottery in healthcare for our child when we decided to stay with our children's hospital. They love our girl so well. And I could not imagine trusting my daughter's life with any other people. And I wouldn't want to.